Hello, and welcome to week 5 and the nervous system. All right, it is the body's highway. All right, and we think about the nervous system as like our little city. All right, we're sending our calls and stuff all over the place. All right, and so our body and our nervous system is getting calls, and so we're helping us move, think, feel. All right, the neurologists play a big part in keeping us all in line and in check. They're the architects and the engineers of our city. Um, the neurologists also know about the brain and the spine and the web of nerves that keep us all going. Okay. So the neurologists are the specialists that take care of us, that take care of our injuries, and take care of anything that should pop up within our nervous system and anything that would keep us from not functioning correctly. All right. So, in our anatomy and physiology, you have the central nervous system or CNS, and it is comprised of the brain and the spinal cord. You have your cerebral cortex, your cerebellum, the brainstem, the motor control, the cognition, the autonomic regulation. Then you have the neurons, the functional unit of the nervous system, and it also transmits electrical signals. You have the condition, like certain conditions that go along with it, like neuropathy, degenerative disc disorder, okay, Alzheimer's. Then you have peripheral nervous system, which is PNS, all right? And you can be evaluated for peripheral neuropathy, okay? Um, Doctors, like neurologists, all right, they will address and study different things within your system, your central nervous system and your peripheral nervous system. Okay, when things go wrong, you may have pinched nerves, different things like that. You may have things that will go wrong with neurotransmitters. You may have things that are imbalanced in your brain, such as anxiety, depression, epilepsy, anything like that. Um, then you have the autonomic nervous system, the ANS, okay? And that regulates your involuntary body functions. Neurologists will see patients with conditions like autonomic pathology conditions affecting you, like heart rate, digestive functions, stuff like that. There's also all kinds of imaging that neurologists can use. All right. And we've mentioned them before, but there's MRIs, there's CT scans, there's x rays, now there's MRAs, all kinds of different things that they can test that go far beyond some of the things that we have mentioned so far. Okay. They can do EEGs. It's just crazy. It's just crazy what they can do. Nerve conduction studies. So there's tests that they can do that we've not even seen before. That's in a normal testing center. And what I mean by normal testing center would be MRIs, X-rays, CT scans, that things that are done on everyday use. Okay. So there's some things that neurologists use that are very specialized to just the neurology team. Okay, for brain function, brain waves, things like that. Mental health and the nervous system. The brain serves as an epicenter of your cognitive and your emotional processes. Mental health deals a lot with anxiety disorders, ADD, ADHD, PTSD, depression, bipolar, all of that stuff. And nowadays, it's becoming more and more accepted that mental disorders are more accepted by the public. You're not a freak of nature. There's not something wrong with you. And that's good to see that it's becoming more widely accepted. Okay. Because a lot of times people with mental disorders, you didn't ask for it. Okay. It's like breast cancer or it's like anything else. It happens. It's not something, you don't ask for breast cancer. You don't ask for diabetes. You don't ask for, neuropathy. All right. There may have been things that you can do to prevent it, but you don't ask for it. Okay. So, other than that, you do have also different types of pharmacology, which is medication that can be used within that field as well. So, that's something that you will learn as you go on in this chapter. There are also different things that they can use going along with the mental health and the pharmacology. There's more mental health assessments, cognitive function, emotional regulations, interpersonal relationships, things like that. Okay. Moving on to the endocrine system, managing multiple hormones. Okay. Your body is full of hormones. All right. And when everything is in sync, that is awesome. Um, but when everything or even one is out of sync, one thing can make everything go haywire. Okay. So picture this. You have your endocrine system and it's managing a lot of hormones, and it's kind of like a radio station where they're managing a lot of songs, sending out a lot of different radio vibes and messages, things like that. And that's what your endocrine system's doing, sending out a lot of hormones. Okay, in multiple different directions, different amounts of hormones depending on what's going on within your body. Okay. And so the endocrinologists are ones that keep our body in check and keep our body in check when it's out of check. All right. So just a little bit of anatomy and physiology to go along with that. You have your endocrine glands, pituitary glands, thyroid glands, adrenal glands, your pancreas, and so much more. These glands secrete hormones into the bloodstream that help keep us all in check. Um, you have disorders like hyperthyroidism, hypothyroidism, imbalances. Okay. Um, some are too high imbalances, some are too low imbalances. Okay. You have disorders such as Cushing syndrome, Addison's disease, that are dysfunctions of the adrenal glands. Endocrinologists manage conditions like diabetes. Then you have other hormones that have dysfunction, like growth hormones for both male and female sex hormones, um, like testosterone and estrogen that get messed up. Um, Also, for the reproductive in females, endocrinologists will address PCOS. That only happens in females, which that's the polycystic ovary syndrome. Okay, which that's females get, which you've heard a lot about. Okay, lately. Um, then we're completely changing gears, and you have the eye and the ear. And so we're going to start with the eye with sight. And we use our eye, well, and our ears. So let's start with, I guess, just that the eyes and the ears as a whole. We use that to take in the world. We use those two senses all the time. Okay. Even when you don't think about it, you're using them. Okay. See and the littlest things, to hear the littlest things, to take in the littlest amount of senses to the biggest senses in everyday life. It's just amazing. So now going into the eye, the optometrists, they specialize in eye wellness and care. Okay. And they work with you to keep your vision clear. All right. And then with the ear, you have the audiologists that make it to where we can hear the best we can. So the eyes, you have your cornea, you have your iris, you have your retina. All right, to start with those. The cornea transmits or is a transparent front part of the eye that refracts the light. Your iris is a colored muscular structure that regulates the pupil size and controls the amount of light that comes in and out. The retina is the lens behind the iris. There are some conditions like cataracts and glaucoma. Then we have the ear, and you hear with your ear. Okay, I kind of like that. You hear with your ear. And you have an otologist, and that's who oversees your hearing, oversees the sound. Okay. And also, sometimes when you have hearing imbalances or you have an ear infection or something wrong with your ear or your inner ear, you may be off balance. So not only do they deal with hearing, but they also deal with the balance. Okay. And so they deal with both the hearing and the balance. Okay. So, just a little bit of the anatomy. You'll have the inner ear, middle ear, outer ear. You'll have the ear canal. You'll have your tympanic cavity, eustachian tubes, cochlea, semicircular canal, stapes, and so much more in your ear. Okay, so that's just a little bit about week 5. So please don't forget to do your knowledge check. All right, and that's the signals, hormones, sight, and sound. All right, so get that done. Your week 5 discussion questions, the first response or post is due by Wednesday. The other 2 responses is due by Sunday, so you should have a total of 3 responses. Then you have your week 5 assignment, the nervous system, endocrine system, and sensory organs. That's due by Sunday. It should take you 3 to 4 hours to complete. Then you have your week 5 virtual labs that are due by Sunday, and those should take you about an hour and a half to 2 hours to complete. And then your week 5 quiz. It's over chapters 12, 13, and 14. It is worth 100 points. And then there are 2 attempts. Okay, they'll keep the highest score. And if you have any questions, comments, or concerns, please let me know. Okay, you can reach me by voicemail, text, or by email. And we are almost there. This almost the end of the term. And week 6 will be a shortened week. So if you guys need anything, please let me know. I will talk to you soon. Thanks. Bye.